Hi, today I'd like to talk to you about how Botox is injected and give you a little demonstration. So for this I put on my cheaters, and Botox comes in a box, in a vial, and it's powdered when it comes. So it needs to be dissolved with saline. So that's the first thing we do. We dissolve it with saline, and then once it's a liquid, come over here where I've set up a brand new sterile drape. Get our little Botox syringe with its little tiny needle, and we draw up the Botox that we're going to need to use, and that's determined by what it is that we're doing, which in turn has been determined in the conversation with the patient before we start. Every treatment is specific to the patient, to what areas they want addressed, and to how their muscles are structured. So the next thing, we start paying attention to the patient. Move the light over so that everything can be very clearly seen, and clean off the patient's face, prepping it with alcohol so that we don't tattoo in any makeup or street grime, and also to minimize the risk of any infection, which with Botox is very, very rare. So we get that all cleaned off. Today, we're going to be addressing these lines, the frown lines. Some people call them 11s. And we're also going to be, relax your face for me, sweetheart. Stop smiling for a second. I love your smile. Just relax, though. We're going to also address the corners of her mouth. As we age, sometimes the corners of our mouth drift down a little bit, and there's a muscle here called the depressor anguli oris, which pulls those corners down. And if we relax that, we'll get a little bit of a smile for her. So, in order to know exactly where the right places are to inject, I need to assess her anatomy. Frown for me, please. Good. Here you can see I need to resharpen my pencil. Fortunately, I carry a pencil sharpener. This is just a white mineral makeup eyeliner. Doesn't leave any permanent marks. So here we can define where are the edges of these muscles. You can see that there's a muscle here that goes up rather higher. There's this muscle here, which squeezes in. And this muscle here, likewise pulling in. Okay, you can relax. And then when we're looking down here, we have, can you pout for me? These muscles right there that are pulling down the corner of the mouth. Okay, you can relax. As I said before, the needle we use is really small. Really doesn't hurt. There are some people who get a little anxious. I can give you something to squeeze if you're anxious. For some people who feel that it's uncomfortable, we put a little ice on before we do the injections. And coming soon, we'll have nitrous oxide, laughing gas, as an option for people who are anxious. But this lovely lady told me she's not anxious, so we're I'm fine. We're just going to go ahead and do this. So I'm going to start over here. I'm going to support the brow. And this is in part to minimize the spread of the Botox as I inject it, so we don't go to other muscles. And we watch carefully here. We're right in the muscle. That's good. Come on out. You okay?
Yes, thank you.
Number 2. It's not a very large amount of fluid, but you can see it does produce a little bit of swelling and sometimes a little bit of bleeding. Not a lot, that's about as bad as it gets. And that swelling usually will go away within 5 or 10 minutes. So most people have no swelling by the time they leave the office. And then we just hold that for a second, blot it so that it doesn't keep bleeding. And the amount of bleeding is variable, but again, it's really just normally just drops. Bleeding is increased when people have had aspirin intake in the last week, ibuprofen intake in the last week, heavy garlic intake, certain other things. And when you make your appointment, when we send you the confirmation email, you'll have in that email instructions on the things that are best avoided. So now we're going to go down and we're going to do these muscles here. Pout for me again. Good. So we're right in the right place. And once again, here we go. Those muscles are a little deeper, but not so much. That's great. Turn toward me. Excellent. Okay, and you can relax. That's all done. Now we just clean off the white marks so it doesn't look like she's got a crazy makeup on, ready for a performance of some kind. It'll take 3 or 4 days for that Botox to kick in, and at that time, she will no longer be able to make those frowny faces. The corners of her mouth will no longer be pulled down, and she'll have a slightly happier look, and these lines will begin to be erased.